Hi, it's Jerry, and I am here this morning talking with Senator Hannah Beth Jackson, who joins us from an undisclosed location under a lock and key at her house. Senator, thank you so much for being with us. I know you're really busy working on this issue, and we appreciate you taking the time.
Well, my pleasure, Jerry. It's really important to share information with the public so that people have some sense of what government's doing and what they can do to be part of this collective purpose of getting through this crisis and getting back to normal.
Yeah. Okay. Well, let's go in on that, getting back to normal, because that's the question there. Everybody wants to know, when is this going to be over? And it seems to me, I mean, the easiest way to think about this is at some point we will have a vaccine, whether it's 12 months or 18 months or however, and then we'll all be able to gain immunity to this virus, which we don't understand very well. But between that and backing up to now, it's up to decision makers and policymakers like yourself to help us navigate that road. And there's obviously a tension between those who say, the public health has to come first and always, and those who are saying, wait a minute, we got to get back to some semblance of economic normalcy. Where are you on that continuum?
Well, the question that they are two, they shouldn't be, but they are becoming two competing interests. One is the public health and safety the primary concern, or is it the economic well-being that's the concern? I like to think that we can really try to do both, but number one is public health and safety. We are looking at a pandemic where 500,000 people around the world have been impacted by this. We've seen here in the United States 22,000 deaths. That's 4 times, well, let me see, no, it's more than that. It's 7 times the number of people who died on 9/11. So the extent of this is massive, and every state has been impacted, some places, of course, more than others. But, who are we going to give up for
Yeah.
the economic well-being of corporate America? Grandma or our own children? I mean,
Take it
this,
easy on grandmas and grandpas, okay?
yeah, well,
Especially on this call.
I
All right,
can relate
listen,
to that,
let's
yes.
break it down a little bit. So the Governor Newsom, is using a computer model, and we've all heard a lot about these epidemiological forecast models. And he's saying we're not really going to peak until May, the middle of May. That's when it's going to. Others are saying, and I know the University of Washington has just revised its forecast, and then, of course, locally, there's some excitement around another model that said, no, the peak is today or Wednesday. We've flattened the curve. Things are going to go down. So it's time for the governor to lift that statewide stay-at-home order, and for local governments, counties, be able to make their own way in deciding about reopening the economy. Where are you on that continuum in terms of May versus tomorrow?
Well, I'm looking at our medical experts, our public health experts. They're the ones that know best. And the modeling has changed in great measure, I believe, from what I have been told and read from the experts. And I want to emphasize, we really do need to get to fact-based, medically confirmed decision making on this. And part of why we're seeing this flattening, at least at this moment, is because of the orders made by governors like Governor Newsom that say, listen, we want people to stay away from each other. This is such a unique virus that people can actually have it. They can be contagious and never even know it. And so the fact that the virus also can stay on surfaces for a period of time and is unique. We have never seen this virus before. We're sort of learning as we go. And we have taken a look at what we've seen in other countries, the disaster that occurred in Italy and in China and in Spain and other countries, those that seem to have had a better handle on this, like Germany, and those that did not, like Italy, where we've seen huge numbers of people die. So we have modified those models based upon the fact that we are now distancing, physically distancing from others, that people like you and me are staying at home as we've been directed to do, and we're seeing a reduction in the number of cases, but we also don't have adequate testing. So a lot of this is really hypothetical.
Yeah.
There may be a
Yeah.
lot more of this out there than we know, and no one really knows whether or not we're at the end of the potential problem or just at the beginning.
Right. At the end of the beginning or the beginning of the end or
There
exact.
you
And
go.
the other thing about this virus, I was listening to a podcast the other day, and it was a really interesting way of putting it. It said, this virus is now everywhere in the world at the same time, and the human race is immunologically illiterate about it. We have no antibodies
That's right.
to fight it. So it is unique in a lot of ways. So what I hear you saying is you're going to stick with the governor's model, that looking at May rather than this week as the best time to begin
Well,
lifting.
I think we need to look at the medical models. Now, no one said that they're perfect, and but their interest in modeling is based upon healthcare and medicine. And I think at this moment in time, that should be our number one priority. What do the doctors say? And listen, if the more we're spending time and effort and resources at understanding this virus, something that we should have done when it first evolved and did not, and that's a shame on our national leadership, but shame on the leadership of other countries as well. And now we're trying to catch up, and we're trying to learn about this virus. As you say, Jared, it's an interesting virus because it is a coronavirus. The common cold is a coronavirus. The flu is a coronavirus. And yet we know with the common cold, for example, that we really don't ever develop an immunity to it, that there's no real antibodies. So you can get a cold 1 week, and a month later you can get another one, and a month later. So we don't know whether this is a virus that is going to create long-term antibodies from which we can then try to identify when people can go back to work, if there is such a thing as herd immunity without a vaccine. Nobody knows. But to try to assume based upon a model that has been modified because we've taken certain behavioral steps to reduce the likelihood, I think is folly, and I think is dangerous.
Yeah, and of course, the risk from the public health perspective is as soon as you lift social distancing measures or stay-at-home orders, then you get another spike that it comes back, or 2 weeks after that,
Sure.
that you would. But in your mind, what are the markers? What are the kind of milestones along the way that we need to look for and to meet before we can begin lifting the kind of mitigation measures that have been put in place, particularly in California?
Yeah, I think, frankly, the most conservative viewpoint here is that they're medical markers. Because, again, if we start going back to the way things were, we are going to see an enormous spike because we do not have a vaccine. We do not know whether or not people have developed the antibodies. They're working on it, and I hope that we start seeing some success. But right now, we are in uncharted waters, and the notion that, well, it's past its peak without any medical justification for it, I think is going to be further trouble. And I think it will prolong the problem rather than shorten it. I think if we try now to bear down, I know it's uncomfortable for people. I am no happier about this than anybody else. I don't mind working, and I've been putting in 10, 12-hour days, and that's fine. But I sure would like to be able to go out and hang out with friends and sit down at a restaurant and have a decent meal. I'm doing the cooking now, and that's a challenge in and of itself.
So I've
But
heard.
of course, there is takeout, and we're doing some of that too to keep our local businesses. This has affected everybody, but we have to realize that we have got to come together and work through this, or else this isn't going to go away.
Well, let's talk about the testing, because obviously that's that's the basis of the unknowns and the unknowables that we have. We don't have a denominator for telling how widespread it is. what is your understanding based on what's being said in Sacramento and in the governor's office and the California Department of Public Health? Where are we on testing? How close are we to getting a widespread test that not only people can get, but that can get turned around quickly? Because if you could be negative today, but in 3 days, it could be different.
Exactly.
Where are we in that? How close are we to having a robust testing mechanism?
Well, we are certainly moving in that direction, but we are nowhere near close enough to it because we really don't have any kind of uniform testing that is quick and has a quick turnaround that is reliable and consistent. This was something that there were tests being developed. The World Health Organization had tests, but this White House said, no, we're going to make our own tests. They haven't done it with any kind of massive. We need to have a huge number of these tests available. As you say, we've got 40 million people who live in California alone. And again, one day you may be negative. You might come out with a false negative or a false positive if the tests are not as accurate as they need to be. But we are working on it. There are incentives. The governor and the state have really committed to working with the private sector. And I think this is an important relationship, a public-private relationship, to do research, to do testing, to create tests that will be effective and reliable in determining where this disease is going, who has it, so that we can try to remove people as quickly as possible from the normal stream of business. We still have people going to work every day for essential businesses. We're seeing a huge spike in the virus in areas where you have communal congregate relationships, like our prisons. Lompoc is having a terrible problem. Our senior
healthcare workers also
and our healthcare workers, of course, because we don't have the personal protection that they need, the masks that they need, the kind of aprons and protective gear that they need. So yes, I mean, the people still at work are at risk, and we have got to get a handle on that before we decide to put people back in the workplace.
And it's pretty clear that the state of California, the governor and the legislature, we're going our own way on this. We're not waiting for the feds to say, oh, here's the test and here's your ration of the test. We're developing our own capacity. Is that correct?
That's absolutely correct. And I think, frankly, that there has been such an absence of a cohesive national plan. The CDC is an organization that was set up to deal with just these kinds of problems. The reason that we were so effective when it came to the Ebola virus, when it came to SARS, when it came to the N1 virus, we were able to nip them in the bud because we had a coherent national plan and worked internationally with other agencies to snuff these things out before they became the pandemic we have now. Instead, over the last 3 years, this country has basically dismembered its CDC operation, so that we have not been doing the testing. We have not been doing the advanced work that would get us to the point where we could have contained this at its earliest stages. So California is saying, you know what? We are a nation state. We have 40 million people. 1 out of every 8 Americans lives in California. We're the 5th largest economy in the world. We are going to lead the way, and California has been doing that. But we're not doing it alone. We're doing it reaching out to other states that need our help, because we have a mutual aid mindset here in this state, and that we are working with other states who also understand that we are one team and this is one fight. It is a fight that is a national fight and an international fight.
So California, I think, at least if you read the national media, has done a pretty good job. And if you look at the numbers, is there anything we could have done differently or done better? President Trump gave himself a 10 out of 10. Do we get a 10? Does the state of California get a 10 for handling this?
Given the circumstances, I think California has done very well. But we're all kind of working this through in real time. There hasn't been a lot of preparation. The state and most states, when things got tough, they dismantled their kinds of programs that are designed to deal with emergencies. We never know when an emergency is going to come, and that's why we need to be ready. Now, California has had so many disasters that we have are probably the best prepared of any state in the country, whether it's been our wildfires, our floods, earthquakes, things like that. We have been developing a kind of system where our emergency response is the best in the country. So I would give us a high score on that. But, you know, in spite of what we might hear from the White House, nobody ever gets a 10. In hindsight, I'm sure we're going to see things that we could have done better. But certainly, this governor has been moving forward with great speed and determination, and the legislature has been working closely with the governor's office to make sure that we protect our people as best we can.
All right, let me ask you about a couple of these economic questions. So the EDD, the Employment Development Department, is in charge of unemployment insurance and getting that insurance relief to Californians. And you know, with all due respect, it kind of makes the DMV look like a model bureaucracy sometimes. So they're going to get hit with this absolute avalanche of unemployment applications. I heard 13% unemployment, 16% unemployment in the state. What has the state done or are doing to make sure that that goes more smoothly?
Well, let's put this in context, if we could, Jerry, because they are the EDD, and I'm not an apologist for the EDD. Even on a good day, they, I don't think, have been quite as responsive as they could be. But again, when you look at bureaucracy and you look at people who think that we need to just cut government, the government doesn't serve any purpose, at times like this, we recognize how important government really is. And the EDD is a very important part of this process. It is processing an unprecedented number of claims, 2.3 million new claims in the last month alone. When you put that in context, that is more claims than they processed during the entire year last year. So it is a staggering number. The state has paid out about $684 million in unemployment benefits last month alone. And for the week ending April 4th, they processed 925,000 claims, which is an increase of 2,400% over the same week last year. So
that was week to week, 925,000 they did, and it was a 2,400%
increase over the same week last year. So people are struggling to get through on the phone and are understandably frustrated. So what the state has done is they have taken and I think increased by I think several hundred, I think 600 to 800 the number of people who are being trained now to process claims over and above their standard staffing. And they're now open from 8 to 5 p.m. They were open from 8 to 12. And after 12, they were processing the claims that they had received. Now they're actually putting together staff to be working 24 hours a day, 7 days a week to try to process these claims. So again, this was a tsunami that hit essentially without warning. It was really hard to know just exactly how badly the modeling appeared. You know, we were estimating, when you take a look at what was happening in other countries who were not doing this social distancing and staying at home and what have you. I mean, we were in for a massive influx of deaths and the inability to deal with people who were suffering from this disease. So once this hit, and the claim started, the state really has tried to respond, but you are talking a 2,400% increase in the course of a week over what it was a year ago. Had we had this number of people on staff, we would have been accused of creating this fat, overindulgent bureaucracy that wasn't doing anything and was just burning taxpayer money. So it's kind of you're darned if you do, darned if you don't.
So all politics is local, and we're, you know, our local EDD office over there on Ortega Street. Now, is somebody on your staff like monitor that specifically? You know, what's happening here in Santa Barbara?
Well, we get a lot of calls, Jerry, is how we're monitoring people calling up and saying, hey, look, I've been on the phone listening to that god awful music for hours at a time, and then they're not picking up. My focus has been on, and the local agency works through the state. So with complaints that we're hearing and things that we think need to be done, the best way to address this is, and we have been going right up to the state, the best way to file for unemployment is still to go online. It is still to process through. At the end of the day, you do have to make a final call. But the governor has also made it clear that we are waiving these time constraints, and we are trying to process these things as quickly as possible. And of course, the good news too is that with the federal package, the stimulus package, that additional $600 a week will be starting this week, so that people can start putting money in their pockets and going out and buying the groceries they need to feed their families.
So people who are applying for unemployment insurance should go on the EDD website. Is that?
That is probably the fastest, best way to make that application.
All right, let me ask you something about small business, because I know after the debris flow, you were active in helping people who were having problems with their insurance companies, who wanted to cancel or say, no, this didn't cover it, and so on and so forth. But, we're hearing from people who have business owners who have something called business interruption insurance.
Right.
And are finding that after the SARS, MERS pandemics, there was a little fine print added to their policy saying this is not going to be paid. Your business interruption won't be paid if it's caused by a virus or pandemic. Is that something you're hearing about? Is there anything people can do about that? Is there
I am hearing
the
about
insurance
that.
Commissioner, the state commissioner aware of that?
Yes, very much so. There are excuses, if you will, and the policies, as you mentioned, after the SARS epidemic, started writing in exclusions for these kinds of events. They are now the subject of some lawsuits to challenge the ability of the insurance companies to do that. I suspect the insurance commissioner will participate. It's a very tricky business, though, this insurance business, because it's very hard for us to tell insurance companies what they can and cannot do. The way they're set up in this country and the way they're set up in this state, they have an enormous amount of independence. There's just so much that the insurance commissioner can do. But through litigation, we'll probably get a better idea of just how far the courts believe the insurance companies can go at excluding different kinds of circumstances. There are also other policies that limit that the event that is the subject of this insurance has to have caused a physical problem with the company, have physically impaired the ability of the company to operate. Does COVID-19 do that? We're not sure. I mean, there are a number of different things. I think the best advice to give to small businesses is to contact their insurance companies, their brokers, their salespeople, and try to work through that, because, unfortunately, far too many insurance companies, at the end of the day, they're like, your 2-year-old grandchild. All they want to do is say no. And we are definitely being challenged in that arena, but there will be litigation to see whether or not we can pierce that kind of.
All right, and you're going to keep an eye on that in your office,
Absolutely.
and you'll be advising business owners and so on if there's further steps they can do. Then.
Oh, absolutely. But the best advice right now is to talk to your insurance company. Some will say yes. And this happened also with the debris flow, Jerry. Some companies were very forthcoming and cooperative, and some were not. And at some point, we had to do some legislation. And perhaps that's where we'll end up at the end of this as well.
And then Congress has already approved, and the president signed money for small business loans. And supposedly this week, they're going to try to work on a package to increase that amount by at least $250 million. How is that? What's the pathway from Washington to small business owners here? What do you advise small business owners to do in terms of connecting with one of those loans?
Well, the best thing they can do is to connect with the SBA, the Small Business Association. That's really where a lot of this money is coming through. It's tricky in that most of that money has already been spent, and that's why we need this second wave of relief because. A number of companies were getting small loans. In some instances, where companies were keeping their staff on, if you kept 90% of your employees on, those loans would be forgiven and become grants at the end of a period of time. And again, a lot of this does go through the Small Business Association. That's the place I would recommend.
Administration, yeah.
And
so there's not really a state way
No.
station on that.
No, it's not. The state has tried to do a few things, but you know, the distinction that we need to think about is that the feds can keep, you know, making money. They can keep printing money. They can operate on a deficit basis, and they do and have been, and they blow holes through the budget, and at times like these, they're particularly needed. But the state has got to operate on a zero deficit budget. We don't get to print money. We can only deal with what's in our coffers. And of course, we've been very lucky and fortunate that we have been able to see a period of enormous growth, and we have a healthy reserve and rainy day fund. And my fear is that we're going to be using up a good portion of that.
Oh, we're going to get hammered, aren't we? I mean, the sales tax, the capital gains tax, you know, the way that our state tax system is so out of whack and heavily dependent on a small percentage of high income people. I know you got to go, but just real quickly, I mean, what's your forecast for how the state budget's going to look? I was listening to the county budget briefing this morning, and they're just waiting to see what the states and the feds say.
Well, a lot of this is going to depend on reimbursement through the federal government. A lot of the expenses that the state is doing now, we're hoping and we expect and we're entitled to, of course, one never knows, about a 75% reimbursement rate for a lot of these expenses. It will depend, you're right, sales tax is, you know, not very high. Capital gains, we're seeing the stock market start to go back up a little, but the state really relies heavily on sales tax, capital gains, corporate income, and of course, personal income tax, all of which are down and will probably stay down this year. It's going to be a much tighter budget than we had expected, but given the fact that we've got about $20 billion in those reserve rainy day type funds, we probably can make it through this year if we are very circumspect. We're not going to be advancing and expanding programs and our educational system as we had hoped, but this is a crisis and we have to tighten our belts and we will get through this.
Well, what about the ambitious plans that the governor and some in the legislature had laid out about housing and homelessness? What's going to happen to that?
Well, you know, this may be the opportunity to do more with housing and with homelessness, because right now we're trying to find places for our homeless. We're trying to expand resources for housing. When the recession, we are going to be in a recession. The nation is in a recession right now. I don't care what you hear from
two consecutive quarters of negative.
Oh, absolutely, yeah. And with the unemployment applications going up and the companies that are really having adverse economic impacts, which are most companies, frankly, a place where we might be able to really expand on short notice is the building industry. Repairing our state and our national infrastructure would be a logical and a good place to get started to kickstart that economy that is desperately going to need help once we get through this pandemic.
All right. Last question. You were supposed to be back in session up in Sacramento this week and last week too, if I'm correct. You know, it's a big problem in Washington because they can't vote remotely. What's the situation here? I mean, can you vote from your house over there? Do you have to be in Sacramento? You know, that flight up to Sacramento, you're the anchor tenant on that one. I mean, you're not flying up there.
I know that's been one of the best the best things that has happened. as far as transportation goes, that direct flight, it's been suspended indefinitely. So I will probably be driving back to Sacramento. I don't want to be on an airplane, and I don't want to be in airports when they start getting busy again, just for the, the warnings that have been given. But we're not really sure, Jerry. The Senate believes that we actually could do voting remotely. There'll be some compromises made. We're going to be having hearings. We have a hearing coming up this Thursday, an oversight hearing on the money that the governor has spent already for his very rapid and aggressive approach to getting more equipment, to setting up our infrastructure to deal with the surge in cases, make sure that we have enough testing, ventilators, equipment, the things. These are expensive. And we're going to do some oversight of that. We're probably going to do some oversight. We got wildfire season coming up.
Right.
And that's not going to be deterred because we've had this other crisis. We're going to have to deal with that. We're going to have some hearings on that coming up. So we will continue to do hearings. I'm continuing to look at my budget and my bill package for this year. It's certainly going to be very different than what I had hoped in my final year in the legislature. But, they say life is what happens when you're busy making plans.
All right. Well, Hannah Beth, Senator Jackson, thank you so much for taking the time to talk to us. And you and Salud and Monique have done, I know, a series of webinar and informational online things, and thank you for that as well.
And we'll be having more. We've had 4, and we're going to be having one this Wednesday at 5:30 p.m. To deal with some of the education questions and issues that have come up.
All right, we'll put that up on Newsmakers.
Thanks so much, Sherry.
And
thanks for your time.
And don't forget to call us with any scoops, okay?
Will
Talk
do.
to you soon. Bye-bye.